I'm Dr. Amanda. I'm an orthodontist and CEO of StraightSmile Solutions. We help dentists understand orthodontics better. This video will share an excerpt from a webinar hosted by Clue Dental Marketing and Dr. Lanes of Modern Essence Dentistry. Any patient photos are the property of Modern Essence Dentistry. If you have questions, please reach out at www.cluedentalmarketing.com. If you have questions about orthodontics, please visit StraightSmile Solutions at www.straightsmilesolutions.com. Enjoy the video.
Okay, so let's go ahead and get started. Let's talk about the general classification of comprehensive versus STO, or short-term orthodontics. And I really want to go over this because I feel like this is the whole reason I really got into the whole coaching thing. I didn't go to orthodontic residency to teach general dentists how to do ortho. If you told me that before, I would think you were nuts. I got into it, partially because my friends and my husband and other people were like, hey, I could use help on this case. Can you help me? So maybe I'm not very good at saying no, but then I realized I kind of enjoyed teaching, and I don't have an orthodontic residency anywhere in my state. So, or even dental school for that matter. So it was something that I just started doing as a side hustle, and it just turned into a full-time thing with a lot more flexibility for raising kids. But also what really, really bothered me when I first got started is I started attending some of the GP ortho classes, and I'm not going to name them out there, but you know who they are, that are targeted towards GPs, be it braces, be it appliances, airway appliances, functional appliances, as well as aligners. And they're just wrong. What they're teaching is wrong, 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 wrong. It's totally wrong. It's just slick, fast, and easy, but it's not right. It's not good ortho. And honestly, it made me sick sometimes. It was like, these dentists think this is the right way to do things. And they don't understand the long-term damage they're causing potentially doing this, especially on kids and teens. And it's really not that hard to do comprehensive. It doesn't take that much longer. And remember, it also can be borderline insurance fraud. And I'm just going to throw that out there. And if you want to know more about that, and I hate to use the F word, but if you're billing comprehensives, which for ortho, which is your D80, D87, D80, 80, D80, 90, and you're not providing comprehensive ortho, it can come back to bite you. And I literally had this happen yesterday, not to me, but a friend of mine who was actually a physician. Her kids had phase 1, was not done right. It was actually done by an orthodontist, but she went in and she contacted the insurance, and she was like, they did not do what they promised, and I was like, goodness, I am not helping you with this. But it can come back to bite you if you're billing the wrong thing, you're making promises, or remember, if you're not giving ideal or perfect treatment, that's okay, but the benefits have to outweigh the risk. And too often, general dentists feel like they're pushed into a corner. I only want upper treatment, or I only want my front teeth done. But unless you can explain to the patient the benefits and the risk, and the benefits can outweigh the risk, and long-term, not just short-term, like your bite, okay, you're going to have overjet, but you need to explain, what is this overjet going to do to you in the long term, 10, 20, 30, 40 years? Airway, tongue position, occlusion, abfractions, bite, wear, attrition. You need to be able to understand, TMJ, what is this going to do? If you cannot explain the risk of taking shortcuts, you have no business doing the shortcuts, because it's going to come back to bite you later. It really, really will. I know a lot of you are probably freaking out right now. And if you've worked with me before on a case, I know I have some of my clients in here, I'll give lectures because I want to protect you. I don't want something to happen to you. And I also want your patients to have the best possible treatment. So if you're not comfortable providing comprehensive, it's really not that much harder. And it's not even always, sometimes it's easier. Then don't take the case. If you can't explain the options, then send the patient to an orthodontist, because it's the right thing to do. And if you only are providing STO in your practice, that's okay. But you need to tell the patient, look, I only provide this type of stuff. Here's the risk. If you want perfect, go to an orthodontist. That's all I really want you to do. So we're going to talk about it a little bit more between comprehensive and STO. Again, comprehensive means fixing everything, overjet, overbite, crossbite, transverse, sagittal, AP. You're going to actually get torque on the teeth. You're going to upright the roots. You're going to give a nice, healthy, balanced bite, occlusion on all the teeth that have opposings, etc. Right? We want this bite to be stable for a lifetime. We want this patient to keep their teeth forever, if possible. I like to say my 92-year-old grandma, when she passed away, she had every single tooth. Not her wisdom teeth, but every single tooth. She never had any teeth pulled. She never had dentures or anything like that. She was pretty darn proud of it. And it is definitely possible for people to live a long, healthy life with all their teeth, but not if they have malocclusion. Whereas STO, like I said, it's okay. And there's a lot of direct-to-consumer companies which are basically doing STO. So I'm not going to even go into that because they're very litigious. But, same thing. You got to explain the risks. You got to explain the benefits. So if you're finishing your cases in round wires, it's not stable. It's not healthy. It's not torqued. If you're not fixing overjets, if you're not fixing negative overjets, it's not healthy. But if that's really what the patient wants and you feel that the benefits outweigh the risks, then explain it to the patient, document it in writing, and have them sign. That's all I recommend.